Assalamu alaikum. Dr. Hussain Bushkolaji YouTube channel is with you. And today our topic is rubella, which is part of the MBBS program as well as the postgraduate programs of PCM, public health, even nursing, and even in medical practice. These problems are very much in the community medicine, and community medicine name was started by the College of Physician, by the Royal College of Physician in 70s, and since 74 the community medicine was the main subject, and after this there are certain other nomenclatures which are overlapping or interchangeably used. So community medicine means a doctor is in the community and practicing the medical field as a holistic or at a population level or even at a family level. So this is a specialized field where common diseases as well as common problems are addressed. Uh, we were discussing the rubella problem, and the major problem of the rubella and the other infectious diseases, particularly viral infectious diseases, measles, mumps, and rubella, these are very closely related viruses, and they cause mostly skin manifestation. Mumps gives a parotid gland swelling, but rubella and measles, they produce the rashes on the body almost in the same way, uh, starting from the uh, face and head and come down to the body, while the chicken pox, which start from the body and then it spreads to other face and other areas. So the rubella is a congenital problem. It is transferred from mother to baby, and it causes multiple genetic defects, including cataract, which leads to the blindness, and some other problems are also related. We call it congenital rubella syndrome, CRS. And let's start with our uh, uh, presentation so that we can do it in a better way, and you can understand what is the actual problem. So I should start my presentation. So the presentation is before you, and let us start our way. So now the presentation is before. This is perhaps the last slide, and this shows the vaccine. We will discuss detail, but this was the scientist which actually defeated this virus. Dr. Stanley Plotkin invented the rubella vaccine at the Wistar Institute, which is credited with eradicating the disease in the United States in 1964. So it was the 60s era when United States of America got uh, free from this disease, and Dr. Stanley Plotkin is credited. Uh, these are other types of the patches which are used in the measles, but they are not still available for the rubella. So this is a rubella vaccine, and here you can see the countries having a entire country vaccination program. Pakistan is here, and it is in green entire country. You can see that. So there are many countries where not routinely administered because of the country and no data. But luckily, Pakistan comes under the entire country uh, of the program for this purpose. And then you can see the vaccine. The MMR vaccine is safe and highly effective, 97%. M means measles, M means mumps, and R stands for the rubella for this purpose. Routine immunization is given at 12 to 15 months and 4 to 6 years. In Pakistan, rubella is not part of the EPI program, but there are campaigns, and sometimes this is given to the pregnant woman. Pregnancy precaution: women planning to become pregnant should ensure immunity as the vaccine control be given during the pregnancy. So this is important and this is the bottom line. And we will discuss, but before that, I will show that Pakistan is the entire country where rubella vaccine is recommended. It means that virus is present all over the country. So coming to the congenital rubella syndrome, CRS, extremely dangerous during the first trimester. Normally, the students will be asked that when you have to give the rubella vaccine to a pregnant woman, either in before first trimester or during the trimester. So the first trimester is important, and up to 90% chances of passing the fetus is in that birth defect, deafness, cataract, heart defects, and intellectual disability. So you can see that it damages the entire health as well as the entire body. So I am just showing you this epidemiology. Reservoir is human and can be transferred from transmission is respiratory route, vertical transmission from mother to fetus, incubation period 14 to 21 days, seasonality non-specific, outbreaks can occur at any time. And you can see replication is in the pharynx and regional lymph nodes, and then it goes to the bloodstream. Here you can see that the clinical presentation and history, serology, rubella specific IgM can be part of that. So you can see that this is the effect of the mother to baby transmission, and rubella causes a blindness at birth, and that gives a mother a complete ruining of the life situation. And a mother with a blind child is very unhappy mother, and that is a situation where rubella, and you can see that if this successful pregnancy ends into the CRS, heart congenital defects in the hearts as well as in the eyes, then you can see this is the pathophysiology and how the virus from E1 receptor, E2 receptor protein uh, reaches to the cell and causes infection through the nasopharynx. It is RNA virus, so its replication is of that type. Structure: spherical enveloped virus and nucleocapsid is there, and genome type single-stranded RNA, and it is a positive RNA structure. The genome is kept and polyadenylated, similar to the mRNA. This is, you can see that the map, and this is name is also given 3-day measles and German measles. So this is a picture of the rubella, and you can see that how a patient is having this kind of problem on the skin, but inside many other problems are already discussed. CRS or congenital rubella syndrome, and this is also a map. With this, I think we are concluding the prevention is MMR vaccine, measles, mumps, and normally another word is used. MMR is maternal mortality rate, also means death during the pregnancy of the mother. So this is a confusing kind of question. Sometimes we ask from the students, what MMR do you understand? Then they don't understand. MMR is a vaccine as well as this word is used for maternal death or maternal mortality. Uh, so let us see any other slides. So with this, I think I am concluding this rubella. And if you have good content as well as a new insight, then I think you are now in a better position, your knowledge as well as your understanding, prevention. So the droplet infection means you have to use the mask as well as hand washing, uh, but it is mostly dangerous when it is transmitted from the mother to the child. Normally, it is self-limiting and it is not patient is not hospitalized, rehydration, rest, good nutrition, good hygiene, as well as a contact with the local GP will solve this problem. So Dr. Hussain Bashkolachi YouTube channel is with you, particularly the students of the MBBS, PDS, not PDS, but MPH, MPhil, PhD can understand that rubella is possible when in United States it is eradicated, then why can't we it eradicated in other countries? And WHO should, and even in the uh, infertility and the new kind of the research, I think AI can throw more light on this. And in future, the vaccination is available for this uh, disease, and the United or UK experience shows that when the uh, young females were vaccinated in understanding that they will be prevented from the rubella when they are mothers or pregnant, but that was not a success story. But the child vaccination during this early age with two doses is, I think, the main recommendations of this lecture. Thank you very much, Dr. Hussain Bashkolachi. I am fellow of College of Physician Surgeon and professor in Medical University. And I will recommend that the clinical expertise and vaccine expertise and epidemiology can solve this problem from Pakistan and other developing countries, including Asian countries. So with this, I think we are back to the meeting and we are ending the meeting. Thank you very much for listening.